Want to speak more confidently as a nurse in English? In today's video, you'll shadow me. Just listen and repeat. We'll go through phrases you'll actually use when discharging a patient. Let's get started. Hi, I just wanted to go over your discharge instructions with you. You're doing well and can go home today. Make sure you rest and drink plenty of fluids. Take your medication as prescribed. Do not skip any doses, even if you feel better. You may feel tired for a few days. That's normal. Avoid alcohol while taking this medication. Do not drive or operate heavy machinery for at least 24 hours. Keep your incision clean and dry. No baths, hot tubs, or pools until your doctor says it's okay. Watch for signs of infection, like redness, swelling, or a fever. If you notice anything unusual, call us immediately. Here is the number to call if you have any questions. You'll need to follow up with your doctor next week. Do you have any questions about your instructions? Can you repeat back the most important things to make sure that it's clear? Thank you. We're here if you need anything. If you repeated back these phrases with me,
You're doing great. Great job.
that's real progress. You're doing better than you think. And if you're a nurse learning English and don't know where to begin, check out the course in my bio, subscribe for more tips. Also, feel free to leave a comment if any of these phrases confuse you.
Thanks so much for watching. And don't forget to rewatch this because the more you practice, the more fluent you'll feel.